So welcome to the January 31st, 2025 show. I sent a message in the chat that I've only got a couple topics to talk about today, but I've got a Teams meeting I have to jump on at 2:30. So if you've got any questions, just holler at me. I'll try to answer them. I've only got subscribers who can comment. So if you're some rando watching this by any chance, you'll have to subscribe if you want to answer a question or if you want a question answered. But none of this is medical advice anyway. It's just for fun, but there you go. So you may or may not have seen the video that I had the staff do this little puzzle thing. It's pretty cool. It's like a little maze, and it's got a couple dead ends on it, so it's kind of tricky. I don't know if I want to go through the whole thing right now, but it's pretty neat. The staff had fun with it, but nobody won it, so we had to get some Starbucks as a consolation prize. I can't get it. Back to the start. But anyway, so that was fun. If you are a patient of mine and you want to give this thing a try, let me know. I'll have it at the office. I can let you play with it until I get in the office or into the exam room with you. I got this from judging a science fair. My wife kind of strongly encouraged me to participate in judging, and it was really cool. The kids were cute. They're like 7th graders, and they have their little projects. And for volunteering my time along with 3 other judges, we got these, which was a really neat little prize. And it's just a 3D printed thing that the organizers family had created. So there's that. So one of the 2 topics I had was hypertension or high blood pressure. Very common problem. And why is high blood pressure bad? Well, if you have increased pressure in your blood vessels, it's going to cause damage to blood vessels and other organs. And depending on the type of damage and where it is, you can have increase for plaque buildup in the arteries, which is never good. And you can actually get complications like heart attack, stroke, and even dementia. None of those are a good thing. So that's why treating blood pressure is so important. And blood pressure is also one of those medical conditions that's kind of like a silent killer. Most people, a vast majority of the people, won't have any symptoms with high blood pressure. And they can be walking around with super high numbers and just be like a ticking time bomb kind of. And if not being a ticking time bomb, at least having just continual increase in risk over time because of the damage that is caused from those blood pressures being high. Well, what is a high blood pressure? Generally, if most of the time your blood pressure is 140 over 90, that's too high. We need to treat. But you can have too low blood pressure too. And there's not really, I don't think, a set like this is too low of a blood pressure for somebody. But generally, if, I don't know, if you're always under 90 over 60, that's too low. Because the reason there's pressure in the blood vessels to begin with is because you got to get blood flow to the different organs and blood vessels and nourish them. Blood carries all of our nutrients, including oxygen. So we need to be able to perfuse those organs. So you have to have blood pressure that's at a certain level. So you need to keep it in this range. But surely high blood pressure is the cause of a lot of medical problems and sickness in the world. So we need to stay on top of that. How can we treat blood pressure? Well, there's a few ways. Diet. If you eat more fruits and veggies, less processed foods, i.e. less salt. If you decrease the salt consumption, that will help a lot. Exercise is a great idea. By making yourself fitter and your organs stronger and your blood vessels more numerous, you will be able to regulate your blood pressure better. Getting enough sleep. If you're chronically sleep deprived, your blood pressure is naturally going to be higher. Stress too, if you can decrease your stress. Good luck doing that. That's kind of a rough thing sometimes, but stress reduction, increased sleep, both will lower blood pressure. And weight loss, which goes along with the exercise. That's actually one of, if not the most powerful factor in lowering blood pressure is losing weight. So if you can do that, you're really going to get some big drops in the blood pressure. Decreasing caffeine. Caffeine as a stimulant, or any stimulant, medication or not, can raise blood pressure. So try to limit your caffeine where you can. And if you can't lower the blood pressure with any of those interventions, then you might need to start medicine. And there are lots of medicines and lots of different classes. Some common ones would be angiotensin converting enzyme inhibitors, or ACE inhibitors, angiotensin receptor blockers, or ARBs, beta blockers, calcium channel blockers, diuretics, alpha agonists, alpha blockers, vasodilators. So you've got all these different kind of classes, and not all classes are created equal. Some have side effects that are problematic or beneficial. Some are generally pretty good side effect wise. Some can alter your electrolyte levels, which could be really bad in some cases. So like beta blockers can not just lower blood pressure, but they can lower pulse. So if you're somebody who has a high heart rate, but also has the high blood pressure, maybe we start off with a beta blocker to maybe kill two birds with one stone. Or maybe you've got swelling in your legs all the time that we've determined is not due to any acutely dangerous problem. Maybe we can give you a diuretic or a water pill to start off with and see if we can lower the blood pressure and get rid of some of that swelling. I, as a skinny marathon runner with no extra adipose tissue to speak of, I exercise a lot. As I did a video about all the running I do. I have to take a blood pressure pill. I don't sleep as much as I need to. I eat more salt than I probably should. I drink more caffeine than I should. And I've got the genetic predisposition to hypertension or high blood pressure. My dad was also a distance runner for decades, and he's been on a blood pressure medicine for as long as I can remember. So I was on a blood pressure pill in my 20s in med school. And then I kind of went off of it when I determined that my blood pressure was better when I was at home or on the weekends. And I kind of stopped checking it. And then when I started getting into my physicals every year, my blood pressure was always 140s over 90s. And I would check it again at the office and it was high. So I finally bit the bullet and got started on a blood pressure medicine myself. I take an ARB, an angiotensin receptor blocker, very well tolerated. I don't have any side effects at all. My labs are all fine. I don't feel any different. I just take the pill. And when I'm bopping around from room to room during the week, I don't have those 140s over 90s. And it's always looking pretty good when I'm at home, my reading. So I'll keep taking it. It's the long game when you're thinking about blood pressure treatment, because damage to blood vessels and organs it's a very long process over years and years. So if you can do something to mitigate that for a long period of time, then you're going to live longer and you're going to be healthier in the process. My oldest grandparent lived till the age of 70. Everybody else was gone before then. So I've got that family history going against me. So I got to attack that blood pressure. The other topic I had was about Mychart optimization. Here at the office, we use the electronic medical record called Epic. And Epic has a patient portal called Mychart. And it is a wonderful tool, but also can be the bane of my existence at times, just because expectations for provider and patient aren't always aligned. So I was hoping to go over some stuff that could maybe align some of those expectations so that I can best help my patients. And this is like, if you're my patient, great. These things are important. If you have no idea who I am and it's just a random viewing, this can also be useful for your medical providers. Just a way of kind of like conceptualize how to best use the patient portal. So definitely do send updates. So if I prescribe you new medicine, I would love an update on how that's doing, especially if it's a blood pressure pill. So if you've got a very high blood pressure in the office and we've decided that you should be on a blood pressure medicine, getting some home readings and sending those to me is really, really helpful, because I can adjust the dose if needed or switch you to a different agent. And by your next appointment, my hope is that you come in and everything's great. And I can just be like, okay, great. We'll refill the medicine where it is, and we'll see you in however many months. I also desperately need to know if the medications I prescribe you either are not tolerated or not affordable or or unavailable. So those are super useful, super important reasons to get in touch with me. And I never mind those kind of messages. Hey, I can't get my medicine, needs a prior authorization. The pharmacy didn't have it. There's an issue with this or whatever. I need to know that kind of stuff. And Mychart's a beautiful way to do that because I can instantly, well, not as instantly as my nurse is sending the message to me, and then I can instantly send it back. So that's a great way to keep communication going. Also, if you feel like you're not being treated ideally, whether it's a specialist not attending to your needs, or our office staff not treating you well, or me, can't imagine that I wouldn't be an amazing provider for you. But yeah, if you got beef with me, let me know. Let me know how things went badly so that we can address it. But don't request medications for acute problems that I have not evaluated. Yeah, you may get that sinus infection every year, or you might have a recurrence of this rash that you always get, but I really need to evaluate these things, and I can't just be, well, one, providing free treatment for people, because there's other things I can do than like, treating people who I don't evaluate. There's like, I could see my family or do other things. I mean, charity work's great and all, but I also need to have a life, and I can't just be like waiting hand and foot on people especially people who I haven't evaluated, because you might not come to the right conclusion by just somebody telling you their symptoms or requesting something. So acute problems, you really need to be evaluated in some way. That doesn't necessarily mean you have to come in for an appointment. We can do a phone visit or an e-visit where you submit the questions and I treat that way. But if you got a new problem, I really should evaluate it to make sure that I come to the right conclusion for treatment. Do let me know if you can't get a timely appointment. Especially for me as a family doctor, it's extremely important to have access to my patients and you to me. So if you're having a hard time getting an appointment, especially if you have an acute thing come up, like I've got a cold or a rash, and they tell you it's going to be weeks until you can see me, that's unacceptable. I have partners here at the office who could see you. And if you want to see me for that thing, and you're like, no, I really don't want to see any of the nurse practitioners, the PA, I want to see Dr. O for this, then let me know. Send me a Mychart message. Hey, I've got these symptoms. I can't get in to see you. Is there anything you can do? Because usually I can. I just need to know about it. Don't send long messages. So I get dozens and dozens of messages a day, and I have to triage those. So I start at the top of the messages, like the earliest ones, and I try to address them going down. I like make passes through them, and I'll pick off the ones that are short and sweet. I'll pick off the updates. Okay, great. Or okay, let's do this. You can't get in. All right, let's do this. But if you've got a multi-paragraph message, that's really not appropriate for the patient portal. And you either need to set up an appointment or think of a way to make it more brief, because it's just, I've got so much other stuff to do. I can't be reading through all this stuff. And I appreciate data. I appreciate that information, but I will pass over those messages. I'll get it to them eventually. If you write me a multi-paragraph book, I'll read it, but it might get delayed, and then your treatment might get delayed, or I might not be able to get things figured out in a timely manner. So the briefer you can keep it, the faster I'll get to it, and the better the situation will come out to be. Do send me reminders. So let's say you've got your annual physical coming up and you would like to have your blood work done ahead of schedule, or ahead of that scheduled appointment. There's not a really good way in our electronic medical record to set that up. But if you could send me a message a week beforehand, hey, I'm coming in for my physical, can you order my blood work? I'm happy to do that. I just need a reminder. So that's a quick, hey, can you order my labs? No new symptoms, same stuff as last year. That's amazing. I can put the orders in, and then when you come in, we can talk about everything that's going on, and I can go over the labs right then. And that saves me some time later. So that's a good thing to do. Don't send me messages about a family member under your account. I have more than once, because I'm bopping through these messages as quick as I can, I have to balance quickness and like doing the right thing. It's a delicate balance. And sometimes maybe I just don't catch that a message about a family member wasn't about you sending the message, and I've sent medications over for the wrong person. So please do not send messages about your husband under your account or your kid under your account. You can get separate Mychart accounts for that. And it really keeps things a lot easier for me, and it minimizes mistakes. Do notify me if you can't get in with a specialist, or if the care is not what it needs to be. Sometimes I can do stuff about that. Sometimes I can't, but as long as I know things are going on, maybe I don't refer to a certain provider anymore, or maybe I get my manager involved. But the more updates you can give me, the better. And I think finally, don't expect a Mychart reply after noon on Fridays or before 7:30 on Monday. I have the capability of logging on to the computer at home and looking stuff up, but I try not to make a habit of doing that because I love my family and want to spend time with them. But I mean, sometimes I have to, and that's fine. It is what it is. But I don't get any notifications of Mychart messages. So if you send something on a Friday at 4:30, it's not going to like ping me at my phone. So I have no idea it's there until I log in again. So just expect that I'm not going to see it afternoon. I mean, right now it's 2 p.m., 2:10. I'm still at work. I'm still logged in. I'll see those messages. Let me see if I have anything. I have 2 notifications in my inbox right now, so I'll be able to take care of those. But just expect I'm not going to see it because I stopped seeing patients at noon on Fridays. And I'm usually here afterwards doing administrative stuff, but just expect I won't see it. So if it's urgent, you're going to have to, I don't know, find a different way to contact us, calling in, or I don't know. But this Mychart message is not the best way to try to reach me if it's a more urgent thing. So that's that. Well, I don't see any questions in the chat, probably because it's the middle of the workday and people are working. So good job, working class folks. I know this is a silly time to do a live stream, but this is the end of the day, and I don't want to do stuff at home because I'm spending time with my family, and I got to do my work stuff at work. This is kind of that middle ground where I just do this for fun, and maybe something's interesting, maybe it's not. But that's all I got for this time. I don't know if I'll do these every Friday, but if I've got something to talk about that I think will be worthwhile, I'll try to do one of these. But otherwise, have a great weekend. Good to see you guys. Thanks for joining, and I'll see you next time.